Well, Salim, how do you think that went with Mr. Jones?
I think it went okay.
Okay. So tell me what you were thinking, perhaps tell me what you thought the diagnoses were.
It looks like a case of angina.
Okay, all right. Anything else?
I think there are a number of other things in the history that might indicate that he has an ulcer.
Okay.
And he's bleeding from his bowel.
Good.
And he could also be anemic as a result of that bleed.
Okay. Excellent. Tell me about the way you interviewed him. I just want you to talk me through that, if you wouldn't mind.
Yeah.
How do you think that went?
I think the interview in itself went okay. I asked him the questions in the history that were expected to be asked.
Right.
And I don't think so that I missed any questions in the history when I was trying to develop a rationale for angina.
Okay. Look, and I agree with that. You asked him a lot of questions, and when you appeared to be on the cardiovascular wagon, you then asked him about peripheral vascular disease or claudication and symptoms presumably of carotid artery disease, and that was good. I guess when one is interviewing patients, one has an alternative of either asking open-ended questions and getting the patients to talk about their illness, or asking closed questions, which basically mean questions that give you a yes/no answer. And what were most of your questions, do you think?
I think I did ask, most of the questions were good, and I asked good questions from the patient. And they were kind of like open-ended questions as far as I'm concerned.
Okay, all right. I'd have to say I have a slightly different view to that. I saw them, many of the questions as closed questions.
Okay.
Was the pain sharp or dull?
Yeah.
You know, have you ever had this? It requires a yes/no. There weren't too many. Tell me more about the pain. Okay, was the pain brought on by exertion? You're asking questions like that, and you didn't give him an opportunity to actually talk about his illness. And if you lose out on so much if you don't ask open questions. The patients want to tell their story, and they may actually tell you things that you hadn't even thought about.
Okay.
So I think you need, when you ask questions, try to think about getting the patient to talk.
Right.
And try to ask questions that are not requiring a yes/no answer.
Oh, okay.
Okay. I'm not saying you shouldn't ask those sorts of questions, but they tend to come later, towards the end of the interview, when you want to clarify things, but not at the beginning.
Right.
Does that make sense to you?
Yeah, it's very good.
So, I mean, you've got all the information. It's just that I'm not sure that you gave him an opportunity to talk, and maybe he didn't kind of establish a relationship with him that you would have had you shown more of an interest by asking him to talk about his particular illness.
Okay.
Let's just talk about a couple of issues now. The issue about the family history of heart disease. Can you remember that? You asked him that, and I think I've written down here that he said that his father died at the age of 54.
Yep.
If that had been your father dying at the age of 54, what sort of a response might you expect from a doctor?
Well, I think you might like to show a little bit more compassion.
Okay, did you show any?
No, I didn't.
I didn't see it. You know, this doesn't mean to say you didn't feel for him, but he as a patient wouldn't have got the feeling that you did.
Right.
So maybe you need to just express that a little bit more.
Okay.
I'm sorry about that. What do you think he might have been thinking, given that he's got a shrewd idea that it might be his heart and that his father died at the age of 54?
Well, maybe he might have felt very sad. At that
Anything
particular
else?
time.
Anything else other than sad?
Might be very upset.
Right.
With me as a doctor.
Why? But why?
Maybe because my response to one major event in his life was not what he might have expected from a doctor.
Okay. So he might have expected you to be a bit more empathic and have to show some feelings. But also just think about what he's thinking. He may have heart disease and his father died at the age of 54. What's going to happen to him? So need to think about those sorts of things as well. Okay?
Yeah.
So it's gathering the information which is useful you in making the diagnosis, but you've got to think about the patient and what they're thinking and what they're going through and try to help them through it.
Right.
Okay? All right. I think the only other specific thing I just want to talk about is this business of when he asked for an explanation.
All right.
I suspect at a fairly early stage you had an idea he had angina. What's wrong with telling him at an early stage that this is what you think, rather than saying, look, I don't want to talk about it now, let's examine you and do some tests and then I'll talk to you about it?
Maybe you might not like to tell the patient about his condition if you're not really sure about it.
Okay, and that's fine. So it begs the question as to how sure you were.
Okay.
So and let's just forget about Mr. Jones for a moment, but if you are sure in that situation, it's something to reasonably share with the patient.
Right.
Okay, so that they know that you're sharing everything, you're not hiding anything, they're more likely to trust you. So next time when someone asks you something, think a little bit more about that.
Right.
So look, I've got the form here, which is the mini CX form, and I'll just sort of go through it, and I'll tell you what I thought.
Right.
And there are a number of domains here that are relevant to that interaction that I saw. And the first one is medical interviewing skills. I rated you, I'd have to say, a little less than satisfactory on that, okay? Not too far below it, but you need to think about some of those things that we've talked about, okay? In terms of humanistic qualities, again, I think you need to almost try this role reversal and put yourself in the patient's shoes and say, what would I expect of a doctor who had an interest in me? And just think about some of the things that we've talked about. Clinical judgment, I thought that was satisfactory. You actually, I think, nailed the diagnosis or diagnoses, I think, fairly quickly, and that was fine. I think you were reasonably efficient, almost too efficient in the sense that you were sort of driving with all these closed questions that only required a yes-no answer, and therefore they're very quick and you can move on. But sometimes it does take a little bit longer to engage the patient with open questions. And overall, I thought it was borderline unsatisfactory, I'd have to say, on that.
Right.
So let me throw it back to you now and just ask you to think about your agenda and what you might do differently next time and how you might try to address some of these issues that we've just talked about. So what do you think?
Yeah, I think I need to take a look at my consultation skills and make sure that I address each and every domain that you just identified for me and make sure that I practice these things a little bit more, understand the patient's problem, especially when it comes to family members, and make sure that I do not ask close-ended questions. I only keep them right up to the end of the interview, and the beginning of the interview should mainly be questions that are open-ended so that it gives the patient a chance to describe his or her illness.
Okay, look, I think that's a good start. So I think if you'd like to reflect on those issues, think a bit more about it in each of your history-taking situations that you find yourself in over the next week or so.
That'll be great, thank you.
Is that okay?
Thank you very much.
Okay, pleasure.